My name is Shumaela Saeed, and my ID number is S336243. Today, I will talk about assertive communication and look at its strength and limitation in health and social care. I will explain what assertive communication means, why it is important, where it can be useful, what problems it can have, and how it would be adopted to different people. Assertive communication means expressing views, needs, and concerns clearly, respectfully, and confidently. It is important in care because the way staff speak can affect safety, teamwork, and trust. The style of communication can support patient safety, improve handover, help with the people centered our planning, and protect dignity and respect. But it only works well uh, but it only works well when it's useful with empathy and sensitivity. Assertive communication means being confident while also respecting the feelings and choices of other people. It combines confidence with respect and listening. The slides compares passive, aggressive, and assertive communication. Passive communication avoids speaking up, so concerns may be missed. Aggressive communication can be helpful or disrespectful, or trust may break down. Assertive communication is clear, respectful, and honest, and it works best when adopted to this situation. It also includes verbal and non-verbal features. Verbal features include clear language, a calm tone, respectful wording, active listening, open qualities, and checking understanding. Non-verbal features include open posture, eye contact, controlled pace, attention, body language, and calm facial expression. Uh, One strength of assertive communication is that it makes concerns clear before they become serious risks. It also helps staff explain information honestly and professionally. It supports informed choice and shared decision making, helps staff changing unsafe practice respectfully, and improves MDT communication by reducing vague or unclear messages. The example on the slide is effective because it is a clear and kind. At the same time, it shows concern, explains the problem, and suggests getting help from the nurse. However, assertive communication also has limitation. It is not automatically effective just because someone speaks confidentially. It can be misread as aggressive if tone or facial expressions are poor. It may also be hard to use when a patient is distressed, confused, or in pain. Cultural differences can change um, how also differences can also change the situation, or eye contact are understood, and time pressure can make speech sound rushed and insensitive. This shows that assertive without empathy can become professional centered uh, instead of person centered. The slide shows how assertive communication can be used in practice. In the scenario, Mr. Adam has early dementia and refuses medication because he believes it may harm him. In the case, staff should speak calmly and respectful, ask what worries him, explain the risk, simply improve the nurse improve the nurse discussion at its handover and documents what actions were taken. His concerns, communication needs, and review plan should also be recorded in the care plan. The table shows other examples to inpatient intention, assertive communication, sports understanding, and informed choices. In emotional distress, it helps maintain dignity and trust. In family disagreement, it keeps the individual's wishes central. In safeguarding, it helps raise concerns quickly. In MDT handover, SBAR helps prevent missed or unclear information. Assertive communication must be adapted to individual needs. It is only effective when the person can understand, trust, and respond to the message. For a person with hearing impairment, staff should face them, reduce background noise, speak clearly, and check understanding. For a language barrier, staff may need an interpreter and should avoid slang. For a person with a learning disability, short sentences, visual aids, and extra time may be needed. Cultural differences are anxious. Relatives also needs careful handling. The less effective example on the slide is too direct and does not show empathy. The more effective response is better because it acknowledges worries, asking about concerns, other explanations, and involves the nurse. The slides give suggestion for improvement. Staff should use short, direct, and respectful sentences to improve clarity and reduce confusion. They should acknowledge feelings before giving advice because empathy helps blind trust. Um, they should also check understanding using uh, teach back, adopt communication for culture, disability, language, and anxiety, use SBAR for teamwork, and document facts and agreed plan clearly. Reflection is also important because it helps improve future practice. In conclusion, assertive communication is more than speaking confidentially. Its values depends on empathy, listening, adoption, and respect. I have learned that poor tone or timing can make assertive seems aggressive, but clear communication supports safety, clear planning, care planning, and teamwork. Assertive communication is stronger than passive communication because concerns are not ignored, and safer than aggressive communication because it protects dignity, trust, and professional relationships. In the future practice, I would prepare before handover, use respectful statements, adopt my approach to individual needs, and ask for feedback after difficult conversations. Assertive communication is clear, respectful, empathetic, adopted, and uh, accurately documented. These are and these are the references and my video link for my this presentation. And thank you for your listening. Thanks.